Good evening, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Hilaal Live. My name is Faraz Patel. Would like to thank you, the viewer, for staying with us here on DSTV channel 347 on Hilaal TV. And I also like to thank my colleague Lukman Shadrack for taking you through the first 1 hour. Now, the South African Medical Association has advised that people prioritize hygiene and look at practicing public health measures again. This is as the World Health Organization has declared a new COVID-19 variant, which it says is likely to cause a spike in infections but not increased severity. Joining us now to discuss this is the chairperson from SAMA, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, good evening, and thank you so much for joining us here on Hilaal Live.
Hi, thanks for having me.
Now, it's an absolute pleasure. Dr. Mzukwa, here we go again. Another variant that's coming. Let's talk about this because, I mean, the viewers watching saying, well, COVID-19 just ended the other day. Now, all of a sudden, it's a return. Let's talk about this new variant and, of course, you know, whether it's going to be as severe as we saw, of course, with Omicron and, of course, Delta before that.
Well, thank you so much. Like it was announced by the World Health Organization, we have this subvariant of Omicron that is dominant now in the USA. It is found in other countries, about 51 of them. It is, as you know, easily transmissible, but it does not really lead to severe symptoms, unless, of course, you've got issues of underlying medical conditions like your kidney failure, heart failure, people who are having cancer, other people with using steroid medication. So that could take down your immune system. Otherwise, if they are vaccinated, it should assist with the the immune system, fight this infection.
Dr. Mzukwa, let's talk about those with comorbidities. I want to specifically, because I read obviously your statement and of course heard your voice note earlier on in various other media platforms, the ages of 65 plus. What would they need to do during this period? Because at this moment, it isn't, maybe you could correct me on this, reach South African shores as yet. So those citizens 65 plus, and of course those with comorbidities, what would they need to do in a case like this, should this variant land on South African shores?
We do need to recall that there are public health measures that we were taught during COVID-19. For example, the issue of putting a mask if you are symptomatic. That is, if you're sneezing, you're coughing, anything that would make your saliva come out of your mouth in droplets, it you need you to put on a mask. But also, for those who are symptomatic, they may be living with their grandparents, they may be having colleagues at work who might be having, underlying medical conditions. So it would be prudent for those, to put on a mask because, the symptoms are the same. You will never know whether it's a normal flu or if this is because of COVID-19. But you know that even though it is discovered in other countries, chances are that we already have this because of we're living in a global village. People, you will find that they've already come to our shores, with the virus.
Dr. Mzukwa, it's a two-part question that I'm going to ask next. So what about those who are in hospital, of course, who were admitted because they had COVID-19 and, of course, spent quite a long period in hospital? And the other part to the question, those who have been vaccinated, those, of course, took the 2 shots of Pfizer, of course, the 1 of Johnson & Johnson. What then? What happens with regards to those individuals?
Let me start with the latter one. If you've been vaccinated before, you are fully vaccinated, you might need a boost. So it means you need to go to your card, just check the dates. If it's more than 8 to 9 months, you may need to go back to the local institutions there where vaccination is done and have a shot, that will assist you, boost your immune system so that you are able to face this new subvariant. Because as far as we know, it does not escape this current vaccination. So you might find yourself, especially if you are having underlying medical conditions, having to take these vaccines. But you also talk about people who are in the hospitals. I'm not sure if you're talking about healthcare workers or people who are admitted.
No, I'm talking about those who were admitted in hospital, of course, because I know the number of people who were admitted in hospital for COVID-19 still have a lot of the after effects of that. So those who were in hospital, what care would they need to take now, especially with this new variant coming up?
Yes, if you were hospitalized due to COVID-19, it means you had a very severe form of COVID, with severe pneumonia and stuff like that. So it is important that you make sure that you are vaccinated, but also you avoid large gatherings. If you are going to a place where there is poor ventilation, of course, you can put on your mask, because some people now are not putting their mask even though they are symptomatic. So if you've been vulnerable before, you've been hospitalized, your immune system might be not that very strong. So you do need to put on something like your vaccine. On top of the flu vaccine that we've had in South Africa, that we've had a flu season, and some people may be relying on the flu vaccine. That is not enough. You need to make sure that the COVID-19 vaccine is up to date as well.
Dr. Mzukwa, for the last year in a few months, us, and I'm going to talk of myself especially, with normality returning, we've forgotten the basic hygiene, sometimes in terms of washing your hand on more than one occasion. Of course, you'd wash your hand when necessary, but on many occasions during COVID-19, we were washing our hands quite regularly. How important is it now that we return back to those COVID-19 levels, just to make sure that hygiene is practiced on a consistent manner?
I believe it should be something that we do on a daily basis, regardless of the presence of a virus or a subvariant of Omicron or not. Because you'll recall that, even conditions like diarrhea and stuff like that, they spread, if you don't clean our hands or wash our hands and stuff like that. So it's important that we wash our hands all the time, but also it must be a habit for all of us that if you are symptomatic, that means you are coughing, you are sneezing, it means you need to put on a mask, regardless of what may be causing your symptoms. Because until you're tested, you don't know what is causing your symptoms. So it's important to protect people that are around you, even your colleagues at work. I mean, it would be a good thing that you find yourself protecting your colleagues. They will see you as somebody who's considerate when you put on your mask. So those issues, but also, like I said, avoid areas that are congested or even poorly ventilated because they may cause problems for you. Knowing your status, in terms of your health status, that you may be vulnerable.
Dr. Mzukwa, we are coming up, of course, towards the festive season. It's holiday time here in South Africa. And as South Africans, we love our December and January periods. Should us as citizens be panicking about this new variant? I know that we have a role to play, and of course, government has a role to play, and of course, organizations like yourself have a role to play. But should we be panicking about this new variant? The WHO, of course, is saying it's not as deadly as previous variants. But what do we as South Africans need to do in terms of practicing caution and, of course, not being in a panic mode with regards to this?
You're quite right. There's no need for us to panic, but we need to be alert. We need to know that we are not yet out of the woods. We still have the COVID pandemic around us. The virus continues to mutate, changing its shape and forms. So we do need to make sure that we still practice what is best for us, avoiding areas that are congested and with that are poorly ventilated. All the measures, making sure that our vaccine status are up to date. So because you don't want to find yourself going to hospital because you just have a severe form of an infection. You could be protecting yourself in the meantime, but also observing these other measures about public health measures. I think going forward is the practice that we need to know. I mean, in 2019, just a quick one. In 2019, I was in Japan. In Japan, if you have flu, regardless of what is happening, you put on your mask. So if you see somebody putting on a mask, you know that person has got flu. So I think we need to grab that habit as well and continue, to protect our people around us and those that are vulnerable.
Dr. Mzukwa, thank you so much for joining us here on Hilaal Live.
Thank you so much. I appreciate it.
That is Dr. Mvuyisi Mzukwa, is the chairperson from the South African Medical Association. The word is don't panic, but I think it's still important for us to maybe go back to those COVID times and practice a little bit more hygiene if we are, of course, not to have that new variant coming into the country. Regardless, it may come, but if we can practice any sort of caution, I think us as South African citizens need to do that. After the break, I'll be chatting to Shahida Uma from the Teddy Bear Clinic. We're going to be talking about Gerard Ackerman. He has been charged with sex trafficking and abuse. The question we ask ourselves is, does what happened yesterday set the precedent for future convictions and harsher punishments? Do stay tuned to Hilaal Live.